Hi, thank you for taking the time today to walk through the i65 demo with me. My name is Melinda Coghill. I'm the Chief Marketing Officer and co-founder here at i65. So, just a little bit of information first about where i65 came from. i65 is actually the product of a company called 65 Incorporated. Since 2012, 65 Incorporated has been providing one-on-one Medicare enrollment consultations on a fee-for-service basis, so we are not affiliated with the sale of insurance plans or insurance companies in any way. We were started by a nationally recognized Medicare expert named Diane Omdahl. If you were to Google her name, you'd find her in all the publications along the bottom and a lot more. She truly is a nationally recognized Medicare expert. Now, where i65 came from? Essentially, 65 Incorporated could not keep up with demand. So we had to figure out, how do we empower other people to provide the same level of expert, unbiased Medicare enrollment guidance without having to become a Medicare expert themselves? That's where i65 came from. So today, i65 essentially provides Medicare enrollment guidance that is fast, simple, expert, and unbiased. But why is this needed? Okay, so now a little bit of the demographics. Each year in this country, we have 3.6 million people turning 65. Among these people, though, more than half are willing to admit they do not understand Medicare at all, thus making it very likely that as they go through the Medicare enrollment process, they're going to make some sort of Medicare mistake. Unfortunately, just one mistake can literally cost a person thousands of dollars a year for the rest of their lives and even keep them from getting needed healthcare services. To get a handle on how big of a problem Medicare enrollment mistakes are in this country, we created an average client experience among our client population at 65 Incorporated. We then extrapolated that average client experience out to the national population. In this way, we've estimated our seniors are making, about $1 billion in Medicare enrollment mistakes annually. No big deal, just some pocket change. So why is this happening? Well, quite frankly, we are forcing seniors to become experts in Medicare simply to enroll in the program. When a person is about to turn 65, that person will automatically receive a booklet in the mail from Medicare explaining the enrollment process. The 2018 version of that booklet is about 150 pages in length, and it's not even comprehensive. So when our seniors decide, I can't do this on my own, I don't want to do this on my own, where do they turn for help? That's why they're making it up. They are turning to professionals that they have a trust relationship with in hopes that you can provide any sort of Medicare enrollment guidance. Studies have shown, too, if they have one, a financial advisor will be one of the first places they turn for help. In fact, Vanguard put out a study showing exactly this. First, among the top 3 tiers of client groups, notice the average ages. So it's probably not a huge surprise to note that the number one service all 3 groups say they want from their financial advisor is help planning for long-term care, which according to the study does not mean getting long-term care insurance. It means planning for the healthcare costs and needs throughout retirement, which does include Medicare enrollment. Yet these are topics that advisors largely overlook. In fact, less than 16% of retirement plans today include healthcare costs and needs. That's crazy when you think about it. Huge opportunity, but it does make sense that financial advisors haven't gone here. It's not like you've had tools or resources to help you. Oh, wait, that's right. You do now. That's what I65 is all about. It is all about empowering you to become your client's Medicare enrollment hero. And when you provide this guidance to your client and help them answer their Medicare fears and concerns, you get a host of business benefits. You get to increase client leads and referrals. Turns out when one person figures out how to solve the Medicare equation, they tell their friends. My personal favorite is actually on the bottom. You can literally show your clients how you are saving them thousands in Medicare mistakes. I will show you a very easy way to do this a little bit later in the software. Now, if you happen to have an existing referral relationship with an insurance agent or broker, that's great. I65 does not ask you to break that relationship. In fact, it enriches it for everybody. Here's what I mean. Senior clients want, first and foremost, advice from a source that does not sell Medicare insurance. Now they can get exactly what they want without compromise from their financial advisor. Meanwhile, the financial advisor can provide more value to those high-value clients, and at the same time, that insurance agent can still make a sale because I65 does not sell any insurance, but in much less time. So it turns out to be a very nice win for everybody.